one of the questions that we have, and I think we'd like to share, is why is ovarian cancer just so challenging to diagnose?
So I think you talked about this a little bit earlier, but this is one of the most often questions that we get from family members or even from patients. They want to know why it wasn't found sooner. And one of the biggest challenges is that in its early stage, it often doesn't have symptoms. So it may be a cyst or a mass on the ovary. And until that mass or cyst gets big enough that it starts causing symptoms like pressure and change in the way that we pee or we move our bowels, we may not know. And our abdomen and pelvis can actually hold a whole lot of space. I like to remind our patients, that we carry babies in there and we go months and months before people even notice when you're pregnant. And so those cysts can get pretty big before they cause any symptoms. The other thing that's super challenging is that the symptoms that come along with ovarian cancer are non-specific. And by that, I mean there are a lot of things that can cause those symptoms as well. And so you may feel a little bloated, and you may chalk it up to just being like you ate something bad, or, oh, I'm just getting older, and so I'm gaining some weight. Or you may have some constipation, and everyone goes, oh, I have some constipation. Again, it's non-specific. Or heartburn, right? You may say, I just ate too much spicy food, or maybe I just, did too much yard work, and that's why I'm having some back pain. And so there's a lot of things that can be super challenging, because it's very easy to say these symptoms are just because of X, Y, and Z. And so don't always recognize that these new symptoms are actually associated with ovarian cancer. And I think the point that you made earlier about paying attention to symptoms that are new or different for you, and stay or persist for longer than just a day or two, are really important. And then making sure that if you're having those symptoms and they're getting worse or they're staying, that you do continue to talk to your doctor about it to make sure that you get the testing that you need.